The challenges I've mentioned, there are challenges. There's a longer duration in getting people back to work and function for an injury versus the general community. Why that is, we can all hazard a lot of guesses there, and it's been looked into a fair bit. The approval process, someone comes in, they clearly need an investigation, we need to get approval for that. That can take some time. We also need to get approvals for treatment. So all of that does take extra time. So having an efficient way to achieve that is important. The treating team needs to know about the workplace of the individual, and I don't believe that that is always the case. And as doctors, we should be sourcing our knowledge on that, and that doesn't always happen. Compliance from the patient is important in the treatment. The effects of potential litigation can affect return to work. The system is often adversarial, and there's also employer-employee relationship issues. So just to highlight some of these problems around litigation, I just thought I'd raise a couple of things, looking at a low back pain study, and also looking at a carpal tunnel, which is a wrist operation study. In the low back pain study, there's a substantially lower return to work versus non-compensation patients, 49 versus 89%. There was greater pain when they were reviewed, and the time off work, you can see there is dramatically different, 12 months versus a week. The difference almost being completely seen in those who are actually seeking a lump sum payment. There was far greater psychological issues around those who were claiming lump sums. And the psychiatric diagnosis was very much linked to unemployment problems. Interestingly, settling the claim didn't seem to influence whether they could get back to work or not, and psychological disturbance was not affected by the claim, so they continued to have problems psychologically. And there did appear to be a poor adjustment to the injury in those who are seeking compensation, and this is advanced by the adversarial system. And this poor adjustment makes compliance difficult. Now, looking at the carpal tunnel operated patients, this is where the median nerve in the wrist is being compressed with pain and sensory changes in the hand. It's very common in the community, so that's what we've got to look at as a background against people that are claiming it to be workers' compensation related. But a very different return to work, 4 times the length of time for the workers' compensation cases. And most of those involved in litigation had a much greater return to work. The perceived enticement of financial gain and the legal premise that the more disabled you are, the more money you're going to get, also appeared to affect recovery. And often when people have this surgery, they get lingering symptoms. It's not always 100% successful in removing all their pain and sensation problems, but those who were on workers' compensation interpreted this as not being a successful outcome, and therefore this contributed to their dissatisfaction. There can be some issues around the employer expecting them to get back a lot quicker, which leads to maybe pushing them a bit too hard, too fast. The patient becomes frustrated, and they become there's job performance failure there.